Hey everybody, today's topic is...
Your hearing loss has baggage.
Hi there, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires, and this is Dr. Squires Squared, a channel where we have casual and candid conversations about everything audiology.
If you're not sure what audiology is, hit the like button, subscribe to the channel, and we will make sure to talk about it. Today we're going to talk about how hearing loss has a little extra baggage for some people. It's important to know that we're not talking about hearing loss causing these other issues or the fact that these other issues necessarily cause hearing loss, but we do see many times in the research that hearing loss and these other comorbidities that we're about to talk about are happening together.
Exactly. And what we want everyone to understand with the concept of this series is we want you to think of hearing loss as just the tip of the iceberg. So we hear people say, I can't hear, I'm having trouble hearing. We hear people say, I just have hearing loss. Well, that might be what you see, but there are all these layers underneath that maybe we don't realize or that other people don't see that have to do with that hearing loss. And we're going to touch on all of that today and throughout the series.
First Nope, no wings.
Wings? What does that mean?
I said the first wing. So let's start out by talking about what hearing loss kind of looks like on the surface. So a lot of our patients come to us and talk about what hearing loss means to them or how they are experiencing that.
Mm-hmm.
What kind of things do you hear from your patients?
Most commonly it's, I can hear but I can't understand, or they'll give me one particular person that they can't hear. So I can hear everybody else except my wife, or I can hear everywhere just fine except at church or at a restaurant or in background noise. Background noise is big as well. We hear a lot of people say they have difficulty hearing when there's a lot of other things going on.
Yeah, I can hear but I can't understand.
Mm-hmm.
Yeah, exactly. And you know, we filmed an earlier episode of this podcast about social isolation and what that means to somebody with hearing loss. But really what it is the hearing loss often makes people kind of socially isolate. They
Right.
stop doing things that they used to do
Mm-hmm.
because of the hearing loss.
Yeah, I mean, I had a patient recently tell me I don't go to church as often as I want to because I can't understand what anyone is saying, and that's really sad.
Yeah, I have a lot of patients that'll say something similar to that, or they don't want to go out to dinner with friends or with their family, or they don't want to go to family gatherings because it's just too difficult to communicate.
Right.
So that's actually a pretty good segue into the second part of what we're going to call this four-part series is Your Hearing Loss Has Baggage, is depression.
Mm-hmm. Right, and again, Michael had talked about the episode of social isolation that we talked about, and that leads right into that. And we are planning an episode where we talk just about depression and how that relates to hearing loss, and we have some special guests that are going to give some expertise on that as well. So stay tuned for that one because it's going to be good.
Yeah, the overlying point though is that in the research we do see an increase in the prevalence of depression for people who have hearing loss when compared to the general population.
The next topic we want to introduce is that of cognitive decline and how hearing loss has been shown to be correlated with cognitive decline and possibly memory issues.
Right, and it's a really hot topic in the field of audiology right now, is how does hearing loss contribute to loss of memory and cognitive decline, or vice versa. And I think that that's probably a major concern for a lot of our patients as well. In fact, I do have patients that ask, like, is my hearing loss causing me not to remember things? Or, am I going to end up developing dementia or something like that because of my hearing loss?
Yeah, and those are all really, really good questions, and we're going to dive into that in depth in an upcoming episode. So stay tuned for that one too.
Right. But on the topic of cognition, the last topic that we are going to introduce in the upcoming series is that of cognitive load.
Right, so our brain only has so much energy that it can expend on different functions of our body, and one of those is hearing. And when that is taking a lot of effort from the brain to attend to hearing, if you have hearing loss, then other areas, may not get that attention or that energy.
So the main thing that we want you to remember, and the main take-home message here, is that hearing loss is a major medical issue that is as impactful as many other medical issues as well.
Right, and throughout the series, our goal is that by the end of it, you'll have a better understanding of hearing loss on the surface, but also what lies underneath and how to take care of that.
Yep. Thanks for joining us for this episode of Dr. Squires Squared. If you have any questions, give us a call, 304-428-2403, or shoot us an email at info@hearwv.com. Don't forget to like and subscribe to keep up with all of our content, and we'll catch you next time.
Thank you.
Thanks.